Have you ever felt like no matter how hard you try, your blood sugar just doesn't seem to stay where it should? Maybe you've been told to just eat less sugar or exercise more, but still something feels off. I want to take a few minutes today to speak directly to you about something most people never explain clearly: what's really happening with type 2 diabetes and why your blood sugar can feel like it's controlling you instead of the other way around. First, I want you to know this. I understand. I've seen people who are intelligent, disciplined, who follow advice carefully, and yet they struggle. And when that happens, it's natural to feel frustrated or even guilty. But the truth is, it's not about failure, it's about understanding your body on a deeper level, something that most of the advice out there simply skips. So let's start with a basic question, the one that underpins everything. What exactly is happening in your body when you have type 2 diabetes? You may already know the simplified version: your blood sugar is too high, but let's dig a little deeper. Your body relies on a hormone called insulin. Think of insulin as a key that unlocks your cells, letting sugar from the food you eat enter to be used as energy. In type 2 diabetes, your body's cells start ignoring that key. This is called insulin resistance. At first, your pancreas tries to compensate by producing more insulin. For a while, this keeps your blood sugar relatively normal. But over time, the pancreas struggles to keep up. The sugar in your blood stays high, and that's when damage starts to quietly occur. Now, here's something many people don't realize. High blood sugar is not just a number on a test. It's a signal, a message from your body that something is off. And if we only focus on lowering the number without understanding why it's high, we're missing the bigger picture. Let me be very clear: type 2 diabetes doesn't develop overnight. It's the result of years of small imbalances, subtle changes in how your body processes sugar, how your hormones respond, and even how your stress levels and sleep patterns affect your metabolism. It's not a moral failing, it's a biological response to factors that often feel beyond your control. One of the most overlooked pieces of this puzzle is how your liver, muscles, and fat tissue communicate with each other. When insulin resistance develops, your liver can start producing too much sugar, even when you haven't eaten. Your muscles may not take up sugar efficiently, and fat tissue, especially around the abdomen, can release inflammatory chemicals that further disrupt insulin signaling. It's a complex system, and treating diabetes requires understanding all these pieces, not just cutting sugar. Another thing most people don't talk about is the role of stress and cortisol. When your body perceives stress, whether from work, lack of sleep, emotional strain, or illness, it releases cortisol, a hormone that raises blood sugar. Think about that for a moment. Even if your diet is nearly perfect, chronic stress can push your blood sugar higher than you'd expect. That's why sometimes it feels like your diabetes is unpredictable, like you're doing everything right and still facing high numbers. Your body isn't being rebellious, it's responding exactly as it's designed to. Now, let's talk about another hidden factor: the timing and quality of your meals. Most people think diabetes management is only about what you eat, but when you eat can matter just as much. Eating late at night, skipping meals, or relying on highly processed carbohydrates can cause spikes that linger longer than you realize. Your body has a natural rhythm, and blood sugar management works best when we align with it. You might be wondering, if this all sounds complicated, is it even possible to manage type 2 diabetes effectively? The answer is absolutely yes. And it starts with understanding your blood sugar beyond just numbers. It's about looking at patterns, not isolated readings. It's about learning how your body responds to the food you eat, your activity level, your sleep, and even your stress. For instance, many patients are surprised to learn that exercise timing can make a difference. A short walk after a meal, even just 10-15 minutes, can significantly reduce the blood sugar spike that follows eating. And it doesn't require an intense gym session. Consistency matters more than intensity. Your muscles are very good at taking up sugar when they're active, and leveraging this natural mechanism can make a big difference over time. Sleep, too, is often underestimated. When you don't get enough quality sleep, your body becomes less sensitive to insulin, which means higher blood sugar and increased cravings for sugary or processed foods. Sleep isn't optional, it's a cornerstone of blood sugar management. Now, let's address a topic that causes a lot of fear: complications. High blood sugar over time can affect your nerves, kidneys, eyes, and heart. But here's what's important: complications are not inevitable. They are preventable with consistent, informed management. And the earlier you understand your body's signals and respond appropriately, the better the outcomes. This is why knowledge and awareness are so powerful. They literally protect your future health. I also want to touch on medication, because this can be a source of confusion and sometimes guilt. Taking medicine does not mean you've failed. For many people, medication is a tool that allows the body to regain balance while lifestyle changes take effect. It's not a punishment, it's support. a way to help your body function more normally while you build habits that strengthen your health over the long term. There's also a lot of misinformation about sugar and diet. You do not need to eliminate all sugar to manage type 2 diabetes. What matters is the overall pattern of your eating, the quality of foods, portion sizes, and how different foods affect your blood sugar. Whole foods, fiber, protein, and healthy fats all slow the absorption of sugar and help keep insulin more stable. It's not about perfection, it's about creating a pattern that your body can respond to positively. Another hidden truth that rarely gets discussed is the role of gut health. The bacteria in your digestive system play a surprising role in blood sugar regulation. Some strains of gut bacteria can improve insulin sensitivity while others may worsen it. Eating a variety of fiber-rich foods, fermented foods, and minimizing processed junk can support your gut in ways that translate into better blood sugar control. Let's pause here for a moment because I want to make sure this message is clear. Type 2 diabetes is not a death sentence. It's a signal, a warning, and an opportunity. The sooner you understand the mechanics, the sooner you can take informed action that has real, measurable benefits. And action doesn't have to be overwhelming. Small, consistent steps, walking after meals, improving sleep, reducing highly processed foods, managing stress, these can compound into significant improvements over time. Now, I want to be honest about something many patients struggle with, the feeling of being judged. You might feel that others expect you to have perfect numbers, perfect habits. But diabetes is not about perfection, it's about learning, adjusting, and responding. Every time you notice a pattern, every spike, every dip, it's information your body is giving you. Treat it as data, not failure. Curiosity and awareness are much more powerful than guilt. It's also important to recognize the emotional side of living with diabetes. Fear, frustration, anxiety, they are normal. And addressing these feelings is just as important as addressing diet or exercise. People who manage their stress and mental health tend to have better blood sugar control. So don't ignore this part of your health. Taking care of your emotional well-being is part of taking care of your body. Now, let's talk briefly about monitoring. Blood sugar tracking is not meant to punish you. It's meant to teach you. It helps you see what works and what doesn't. Over time, you'll learn your own patterns, how different foods, times of day, activity, and stress levels affect your readings. And once you understand your patterns, managing diabetes becomes much more intuitive. You're no longer guessing, you're responding intelligently. Another critical truth, type 2 diabetes is reversible in many cases, especially early on. With targeted lifestyle changes, some people can significantly improve insulin sensitivity and reduce blood sugar to normal or near normal levels. That doesn't mean everyone will be medication free, but it does mean that the trajectory of the disease is not fixed. Knowledge and consistent action can change the outcome. Let's discuss one final point, because it's often overlooked. Your environment. Access to healthy food, safe places to exercise, support from family or friends. These factors all matter. Managing diabetes is not just an individual effort. It's a system, and improving your environment can remove many hidden barriers to success. So what does this all add up to? It adds up to hope, understanding, and a plan. You are not powerless. You are not failing. Your body is telling you exactly what it needs. And with awareness, consistency, and the right guidance, you can take control. You can reduce your blood sugar, protect your organs, and live a full, vibrant life. If you take one thing from this conversation, let it be this. Listen to your body, respect its signals, and respond intelligently. Not out of fear, but out of care. Small, informed steps compound. Knowledge is your ally. And help is not just available, it is effective, practical, and empowering. I want to leave you with this thought. Managing type 2 diabetes is not about perfection. It's about presence, being present with your body, observing, understanding, and responding. When you do this, you are already doing more than most. You are taking control calmly, intelligently, and compassionately. You are capable of this. Your body is capable of responding. And with the right guidance, support, and habits, type 2 diabetes becomes not a sentence, but a journey that you can navigate successfully with confidence, calm, and clarity. Take it one day at a time, celebrate small wins, notice the patterns, adjust, learn, and always, always be gentle with yourself. You're doing better than you think. Thank you for trusting me with this time. Your health is worth understanding deeply, and your body deserves the care and respect that informed, intentional choices bring.